All right, let's do our coronavirus update. The cases worldwide now over 2 million. Really only up 40,000, 50,000 from yesterday, which is great. Total confirmed deaths worldwide up only 7,000. Total confirmed recovered almost 500,000. The U.S. now has 614,000 confirmed cases and 26,000 deaths. That is up from yesterday, quite a bit, 587 yesterday, and 23,644 deaths yesterday. The U.S. now leads the world in both total cases and deaths from COVID-19, but it is 15th in deaths per 1 million people, 19th in cases per 1 million people. Officially, all 50 states now have at least one death attributed to COVID-19. Just a note, on the scale side, if you will, traffic-related fatalities in the U.S. were down by 23%, as opposed to the same month in 2019. So we saved some lives by not going out and doing anything. Are we at the peak? We think it was the peak yesterday. The death toll in the U.S. increased after New York included at-home COVID-19 fatalities for the very first time. They had 270 deaths yesterday that were attributed to the virus from people who died at home in New York City. New York City's health department says the total death toll now is 10,000, including the 3,700 total deaths that were added on Tuesday. That included the backlog of several thousand people who died at home and were not counted as COVID-19 deaths. Health officials have cautioned the deaths are a lagging indicator. They don't mean that the sweeping stay-at-home restrictions are a failure. The peak in deaths across the U.S. is expected this week, according to the CDC. So, the WHO. Do we have the audio of Donald Trump yesterday in an announcement in the Rose Garden? He said this.
I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there. American taxpayers provide between $400 million and $500 million per year to the WHO. In contrast, China contributes roughly $40 million a year, and even less. As the organization's leading sponsor, the United States has a duty to insist on full accountability. One of the most dangerous and costly decisions from the WHO was its disastrous decision to oppose travel restrictions from China and other nations. They were very much opposed to what we did. Fortunately, I was not convinced and suspended travel from China.
All right, so here's the real bell that rang yesterday. It's a memo from December 2019 from epidemiologists in Taiwan. They issued an urgent memo to the WHO about numerous cases of atypical pneumonia in Wuhan, China. And the memo suggests that there is human-to-human transmission and urged the WHO to prevent further testing to find the pathogen. The WHO ignored the warnings from Taiwan and continued to reiterate all of China's false talking points, that there was no evidence of human-to-human transmission, that it was no big deal. And that went on until January 14th. Remember, this is in December. This is before anybody really even knows about it. 2 days earlier, by January 12th, more than 700 people had been hospitalized. 102 had died in Wuhan. They failed to mandate that Chinese officials share the strains that would have allowed all kinds of diagnostic tests. Taiwan was way ahead of this. Here's the problem. Why didn't the WHO listen to the epidemiologists from Taiwan? I'm not making this up, because Taiwan doesn't exist. Taiwan is just an arm of China. And so we don't accept any information from Taiwan. We get all of our information about China from Jeddah. Here's the problem with the withholding of the funding. Congress holds the purse strings. Will Congress hold back that money and stop paying the WHO? My guess, no. So is social distancing actually happening? A study of mobile phone data shows only 35% of Americans are following stay-at-home orders across the U.S. I find this story absolutely infuriating. A study including thousands of mobile phones tracked from all 50 states. On average, they say Americans were still taking 2 non-work-related trips out by car per day. Utah, Colorado, New Mexico were the worst offending states with over 2.5 non-working trips out of the house by car each day. Stu, you're a numbers guy.
Yes.
Any questions on this study at this point? Because that doesn't seem right, does it? 35% of Americans are staying home. Everybody else is violating this?
Right. I totally question the assumptions of the study, right? Like, just because you're going out of your house a couple of times does not mean you're not doing the whole social distancing thing. Right? If you're going out, first of all,
right.
We all have, we can go to get groceries. We can go for a drive and not end up anywhere. You can go out to get gas. You can go out to do lots of things. What do you mean non-essential trips? That's a bizarre way of looking at it.
So these trips include fast food restaurants, which you can go into a fast food restaurant and you can be completely safe. That's part of it. It includes hardware stores and home improvement stores. And that one's a little dicey because I think it is essential for our sanity to be able to go to the Home Depot and do some things around the house. Otherwise, there's nothing else we can do. So hardware stores, they are essential. They're on the essential list. And the other one is grocery stores. Well, all of those are on the essential list. The 2 of them are food. What are you talking about?
It's a stupid study. And not to mention, I hate the fact that I get it. We all know our data is out there, but the fact that these people are so easily able to put together these tracking studies of everywhere we've gone is revealing.
That's what it should be. I want a study on how fast these guys have found ways to track all of us. And nobody seems to have a problem about it. By the way, Texas was among the most compliant states with just below 2 trips out per person per day so far in April. I think this is garbage. I'd like to know, with the 2.5 non-work trips, I'd like to know if they went to hardware stores, grocery stores, or restaurants. I count that as in compliance. So what's the real number? Now, here's the latest study on COVID and how it's spread. Air conditioning systems may help spread the virus. My comment, I don't care. If you think I'm going to turn off my air conditioning unit, I'm not going to. Take me to prison, burn me at the stake. I'm not shutting off my air conditioning unit. Period. By the way, 5 new viruses have been found to live in bats. My comment? Can we stop experimenting with bats? I'm just saying. Might be a good idea. And finally, the CDC's plan to reopen America. And this one's better than the California list. Any state reopening must meet 4 conditions. The incident of infection is genuinely low. Now, what does that mean? What is genuinely low, Stu? Is New York genuinely low?
No, I would say definitely New York is not genuinely low. The problem here, of course, is testing is not even. Okay, like for example, we're doing far less tests than some other states here in Texas, even though we have a large population. It's also not randomized, so we're not just taking people off of the street and finding out if they have COVID-19. That way, you'd be able to tell how many people are actually sick and asymptomatic and contagious. We're instead just testing people with symptoms. But still, I mean, you can get something out of that. I don't know what they have to have an actual metric, though. They can't just say, kind of low.
Genuinely low.
Genuinely low
right.
is
they
not
can't
a good,
say that.
No, you got to come up with some sort of
no,
metric.
that's right. The next one is a well-functioning monitoring system capable of promptly detecting any increase in incidence of infection. What the hell is that? What does that mean? A well-functioning monitoring system? Excuse me?
Part of that is quick reporting, right? Like on these cases, we've noticed one thing that is really frustrating is Sundays and Mondays tend to have really bad reporting because they're reporting the deaths from the previous day, and those days are weekend days. So like these deaths they're happening, but they're not getting reported for 2 and 3 days, which is why yesterday's number was the highest it was. But the day before that was a really encouraging number. So it could be that.
Right.
You know, I keep going back to this thing with the thermometers where they have these internet-connected thermometers. Kinza is one of the brands, and they have a sort of a heat map that was able to detect a lot of these breakouts early because a lot of people were taking their temperature and they were seeing fevers. Like, if we're going to spend another $2 trillion, let's say, on another package, maybe it would make sense to optionally, and that's important, optionally provide these types of thermometers to people so they can take their temperature and we can have, again, aggregated data, not specific to you, but aggregated data so we can see when there's a flare-up in a particular area and we should increase testing there, right? Like that type of stuff makes sense. It doesn't seem like anybody's talking about that. But what they're talking about, the way you do this, of course, is South Korea or Hong Kong or, you know, those types of situations, which there's way too much monitoring there to fit into our Constitution. So I don't know how you do this exactly while maintaining the rights that we are supposed to have in this country.
Well, you'll get your rights back as soon as you do these 4 things, and I'm only on thing number 3.
Oh, good.
The public health system is reacting robustly to all cases of COVID-19 and has surge capacity to react to an increase in cases. Okay.
We should
and
have that.
A health
we should
system
have that at this point. I mean, this is the United States of America here.
A health system that has enough inpatient beds and staffing to rapidly scale up and deal with a surge in cases. Well, 2 out of the 4 seem not real vague and seem like we should be able to do it, but what is reacting robustly to all cases of COVID-19? I have no idea. This is the CDC's standard on being able to open the country back up and let you out of your house. This is insane that we're even talking about this. This is child's play compared to what California is asking for and how they're going to open up California again. We are headed for an interesting few weeks, to say the least.